All right. Hi, everyone, and thank you for joining us this evening. We have Dr. Cynthia Matyas, an optometrist from Cambridge, here with us to talk about brain glasses and light therapy, as well as the two treatment modes she uses for those who have had a concussion. All right.
Thank you, Lex. Welcome, everybody. I have a few slides I'm going to share, and that's what I'll start with. So this is me, Cynthia. Actually, I wanted the first one. This is my topic, brain glasses and optometric syntonic phototherapy. In short, light therapy. So we're going to do I'm going to talk about brain glasses and light therapy. And one of the points I'd like to make as I go through this is that we see with our brain. So I hope I convince you of that as I go. This was actually a question Lex had said, why do acquired brain injuries affect vision anyway? All you have to do is look at the anatomy of the brain, and vision is the sense that of all the senses that is most pervasive in the brain. So of course the eyeball is very important here. Right down in the bottom left-hand corner. And we have our two eyes, and on the inside back is the retina. That's the film of the camera, and then when the light hits that, then these electrical signals start and travel through the brain to the visual cortex at the back, and that's when we actually recognize and see things. From there, the information goes to all the lobes of the brain stem, the midbrain, all aspects of the brain have visual input. So when somebody has a diffuse injury like a concussion, it's really not surprising that the visual system is involved. Plus, I know the vision system is involved because when I change the visual input with brain glasses, which I'm going to talk about, concussion symptoms improve. So vision has an input to concussion/vision symptoms. So, there's those, we have two eyeballs, and it's not only sensory, like information coming in, but also there are 6 muscles surrounding each eye, and they have to coordinate. So that information comes from up here in the frontal eye fields, come down to those eye muscles, and they coordinate so we see one clear image, and that often is affected. So what is difficult after a concussion is to converge your eyes or make your eyes go in. And that's called convergence insufficiency. But anyway, let's move on. So when I talk about vision, I'm talking about really 2 functional parts. One is the central vision, and that's only 5 to 10 degrees of the whole visual field. Central vision is very important for seeing charts, and that's the area where we get 20/20. But there's this vast area of spatial vision, which also plays a huge effect on how we perform. And often it's that spatial vision that is the problem post-concussion. So I want to talk a little bit about spatial vision. as let's move on. So here's some kids playing soccer. So they're moving around, they are moving, their head's moving, their eyes are moving. And on the retina, all that's coming is different patterns of light and dark and colors and colors. And yet from that, all that movement, with the help of the brain and spatial vision, that is all put together to provide a stable environment. So the kids know that the ground is not moving, or us here in a room, we know we're moving, not the environment we're in. So vision provides stability in this spatial world. And vision is also totally related to movement. The two just go together. So for instance, if I want to pick up this glass of water over here, it's my spatial vision that is telling me exactly where that glass is. And it's also guiding my movement. So I actually know when to close my hand to pick it up. And that is an example of how vision and movement are just so linked. So if this spatial vision isn't working very well, then that's going to affect movement. Movement like eye-hand coordination, movement like moving your eyes across the page, and movement like walking down a hallway. What happens in post-concussion is this information, you can't count on it. It's giving kind of defective information. So when one walks or moves, you have to think harder. I mean, you can tell me this, and I've asked hundreds of people, that it takes more effort and energy, and you have to think harder to just to walk down a hallway. And when you have to think harder, it takes more energy, and then you're exhausted at the end of the day. Other things that vision is a part of is also attention. Again, I talked about those two eyes, and they have to work together as a unit. But if they don't, or if it's hard to work together, if you can't bring your eyes together, then it's a lot of effort and it's just too hard to focus. So it affects your attention. And then when your attention is affected, your memory is affected. So all these things have a visual component. And the other thing also that vision and light entering the system that has an effect on is mood, one's mood. And the prime example that everybody knows about is seasonal affective disorder, right? Where light is, people do not receive enough sunlight in the winter months when there's very little daylight. Some people affects them so badly that they become depressed. And the treatment is a bright light unit that's applied, that they sit beside or under for, let's say, 20 minutes a day. And that helps that condition. So there's already a therapeutic effect of light. So when I deal with the people I have with the concussions, I usually see them from months to years after their concussion or their last concussion. And these are the symptoms I see the most. So headaches, dizziness. If somebody wants to check off or put their hand up if they suffer from these now, it will be interesting for me to see. For instance, headaches. Okay. Dizziness. All right. And visual overwhelm, meaning like if there's too many people, if you're in a grocery store, it's just too much. Yeah, yeah. And feeling unstable when you walk. Okay, all right. The eyes hurt to move. Lots of symptoms there, all right. And cannot focus or pay attention like before. Yep, okay. And light sensitivity, which the giveaway is the sunglasses, okay, and also, all right. Yes, so I'm going to move on and talk about brain glasses because brain glasses can improve all these areas. So that's what I want to talk about now. So, brain glasses, I'm just gonna, they look like regular glasses generally. And why do I call them brain glasses? Because I've seen on social media people who have had brain injuries. I see that's what they're wearing when I read their comments. And that's why I'm calling it brain glasses. But they're also called neuroprisms or microprisms, because usually, not always, they have a prism in there, and I'll tell more about that. Generally, they look like regular glasses, like what I'm wearing. Sometimes they have binasals here, and sometimes they're tinted, okay? More of an indoor tint for indoor. So what do prisms do? They shift space. Prisms, remember I was talking about central vision and peripheral vision or spatial vision? Regular glasses are only dealing with central vision, which is fine in a normal running visual system. But brain glasses are also looking at how your spatial vision is working. And like I said, it's often not working well post-concussion. So how you can look at it is that information that's coming from the periphery. Sorry, I'm using my hands, but it's the only way I can kind of emphasize what I'm trying to say. So here's this spatial information coming from all the periphery. It comes into the midbrain, and other information from other senses, from movements, from your sense of touch is all coming and integrating there. And what I mean by integrating is, for instance, if I clap my hands, you see my hands come together and you hear the clap at the same time, which is brilliant. You know, that's the brain putting all the pieces together so everything works well and smoothly. So what has happened post-concussion is that integration is not working as well. It might not be so obvious, but it's not working as well. So you can consider the information coming from the periphery is kind of incorrect if you are having these spatial issues. The vision coming in is incorrect and it's not integrating with everything else. So what the brain glasses do, you put on the brain glasses and it's usually immediate. It kind of fixes or makes the visual input better. So it's not quite as off. And as a result, remember I talked to you about movement and balance and stability in the environment. All those things can improve. So that's more than looking at central vision. okay? Because central vision doesn't look at those things. It's the periphery. Now, periphery is also harder to figure out because you can't put an eye chart up there. So it's more performance testing that we figure out which is the best way, what is the best route, what is the best prism for this whoever we're evaluating. So there's a lot of performance types tests when we do this. So it takes more time to figure this out than in a regular pair of glasses. And there might, so it's a prescription, it's prescribed. It takes time to figure out. There may or may not be a tint involved, and tints are different for different people. Some people, and it can make quite a difference. So in an assessment, we go over, you know, is it a blue or a tone light kind of pink, or is it brown? You know, and it depends. Just as the brain is so unique, so how people respond to these tints are unique. And we find out what's the best one by testing them all out. And one thing we do for sure is take you out of a progressive lens if you're in one. I mean, that helps right away. Why? It's because the progressive periphery has been it's distorting vision. Why? So they can make a wider central clear area. And that works fine for somebody who has a nicely working visual system. But for somebody whose spatial vision is not working well, and then you put them in progressives, it just makes it worse. And I find it also makes it worse, even anti-fatigue lenses, I find are not as good as single vision with prism, because they're kind of like baby progressives. So they affect the periphery as well.
Sorry to interrupt there, but your screen is no longer being shared.
Oh, how come? Oh yeah. No, I go back and forth. Oh. So I'm going to share it again.
Okay, perfect.
Thank you. Thanks. I thought I did something I didn't want, but no, that's what I was planning. Yeah, so I was talking about when the brain glasses, they're affecting the spatial vision. The integration of that information becomes better just by shifting and moving the spatial information. So what happens is people, you know, they don't have to think so hard when they walk. They tend to be more balanced, okay? And even be able to move their eyes on a page better, to find the beginning of the next line easier. So all those things happen if you just affect the periphery or the spatial vision. The thing about brain glasses I wanted to say is you have to wear them all day long to get the effect, the best effect or the most effect, because you can tell me that the symptoms get worse as the day goes on. It gets worse and worse and worse. And during the day, we're making thousands of eye movements, and each one of them, depends where you're at, can cause eye strain or discomfort, and that's going to build and build and build. So with the brain glasses, you put them on, and each movement you make is kind of softened. The blow softens the blow. So by the end of the day, you don't feel quite so exhausted, and your symptoms haven't elevated to such an extent. So I thought I'd give you some little stories of some people that I've done lately and their brain glasses. So for instance, I Karina is a 53-year-old teacher, and she's a special education teacher. So she has to go up and down the stairs in her school. And previously she was frightened to go up and down the stairs because she thought she was going to lose her balance, and she had to hold onto the railing. And with her brain glasses, she has a little more balance, and she doesn't have to do that anymore. So she's not afraid of the stairs. I had a PhD student who was still plowing through, even though he had a concussion, and he told me that his brain glasses gave him 4 more hours of focus than previously, because these symptoms don't elevate to such an extent. And then there's the 23-year-old who received her brain glasses, and she what happened at work is her symptoms got worse and worse. So she had this huge headache at the end of the day. And when she had to drive home, she was just, it was very stressful to just drive home from work. It was in the winter, previously a couple months ago, so it's dark, and it was just very stressful for her. So with her glasses, the symptoms actually, in her case, got rid of the headache. So she did not have the headache anymore. She wasn't wiped at the end of the day, and driving home at night was not a problem. So you can see the kind of stories that are out there. And there's one more. I had an 85-year-old lady who had years of balance problems. She was falling all the time, and they were desperate. So during the assessment, I can tell whether it's going to work or not work, okay, because we're trying everything, and we're doing tests with and without the glasses. So I already have a sense, and the person who's trying it has a sense what's going to happen, because we've already tested them, shall we say, through this performance testing. And so the indication was, yes, the glasses are going to help. I know they're going to help. I just always don't know how much. So in this 85-year-old's case, she's still dizzy, but she has not fallen since she started wearing those glasses. So it's very exciting. I just love doing this work, and you can probably see why. I'm going to reshare the screen. I have one more patient who has given me permission to show you his video, if I can just get it going. Right. I hope I can. Oh, yes. So this is Mike. Mike installed fireplaces, and one day he was in a small place, and he lifted up and he whacked his head in the back, and he was off work for a couple months. And he had the typical balance and headache problems. So you're going to see him walk down a line on the floor. And he's going to do it first, and he's going to do it a second time. The first time, take a look at his body. You'll see it kind of wobbles. And then the second time, right after it, he's wearing prism glasses, and watch him with the prism glasses. Okay, let's see if I can. Okay. That looks better to me.
Wow, I can even feel that.
See, he can even feel it. Okay, let's get on here. Okay, so, you know, it's just integration of all the information coming in that provides more flow. You don't have to think so hard, so the energy doesn't sap so hard when you have to think about every move you make. So that's brain glasses. There, let's see. Okay, so let's move on to the light therapy. First, I just thought I'd show, we already talked about the SAD, the seasonal affective disorder, which uses white light. But there's a lot of evidence, and fairly recent evidence, that light of different colors or frequencies affects the workings of our cells to make us healthier. And I just wanted to put up this green field to just sort of see if anybody's bothered by particular colors. Green is kind of a balanced color, so I wouldn't think it would be a problem. Yellow is starting to get to be a stimulant, and red is really kind of annoying to post-concussion people. I don't know what your feelings are about this because I can't hardly see any of you, but that's okay. Anyway, no, I'm not quite done yet. So I'm going to stop share on purpose. Yes, so how does light therapy work? Certain lights or frequencies stimulate the visual system, because what you do is you look at a light of a particular frequency, and basically the light is turned out. So I'm just going to do that now. I'm hoping this light is calming to whoever's looking. So let me just adjust this. So I don't, okay, it's kind of, it's blue. It's not really showing up that well. There, if any color is comfortable to a post-concussion person, it's usually on the blue end, but there's different kinds of blue. And so this is only an estimate here. Anyway, I would be curious if anybody found this calming or easy to look at, or kind of, yeah, relaxing.
Very relaxing.
Yes, you do? Okay, good, good. That's a good sign. Okay. If you can't look at it, then you're not ready for something like this. And there's other things that can be tried. Yes, so going back to blues tend to relax the visual system. So you've got this light, you turn the lights out because you just want the input of that particular frequency. And so you get the most with the lights off. And blues, after concussion, the system is usually in the fight or flight mode. It's just overactive, it's oversensitive, and you want to kind of calm it down. And so that's what the light therapy does. And there are units, like we have home therapy units that we have people take home, and they're like this. And so here's a red. Usually that's too difficult to look at the beginning because it's just too annoying. But that's what we hope to progress to, because it just tells me your visual system is improving. But usually we start with a kind of blue or blue-green, and it helps heal. It helps heal the visual system. And, well, I'm blue. And that's not a very good example. But anyway, blue-green tends to heal. And people find it actually very relaxing. And it's just kind of, yeah, it's kind of like a spa for the eyes, especially after all the, you know, if we do vision therapy, you have to sort of you have to push a little bit. And so this is kind of relaxes your visual system. So the light comes to your eyes, and there's the rods and cones, and then the whole information goes to the visual cortex, and there's a, you know, it spreads right throughout the brain. And that's what we do. So we have people look at the light for 20 minutes a day, 5 or 6 times a week. A lot of the people love the light. That's the best part. They really find it comfortable and relaxing. But there are some, as we heard from Sarah, that it's just too much. It's just too much. And so some things that we do is we actually have them look at the light with your eyes closed, because your eyes are translucent, your eyelids are translucent. So even if you close your eyes, you're still getting some light. You can tell whether a light bulb is on or off. And so we can start gradually with that and work our way up. And it just, I can only tell if I see, you know, how slowly it's going. And knowing about the rest of, you know, what you've kind of therapies you've had so far, like sometimes osteotherapy is a possibility if light therapy doesn't work. But I mean, there has to be an indication for that. But that is one route that I've heard can help. If the light, if the eyes are so sensitive that you just can't use the light, sometimes you just need that cranial manipulation, and it can help. That's all I've got for that one question, for what information I have. Oh, and then I thought I'd talk a little bit about stroke. I have one fellow, actually, 65, we've been working. He had a hemianopsia, and we did light therapy on it, light therapy and vision therapy, and he did improve. So, and I have the visual fields to show, and it didn't come all the way back, but what's happened, you know, a hemianopsia is the half of the field is gone. And usually there's a very demarcated line right here, and probably for the quadrantenopsia as well. It often has got quite demarcated lines. And so what happened for him was his line from seeing to non-seeing started to shift over a little bit. So he could, yeah, he was seeing more, and he's, so it gives him a boost, you know, as opposed to just waiting for time to heal. You can do things. You can do activities in your periphery, and light therapy. Light therapy can stimulate the rods and cones that are left, that are still working nicely, because light of certain frequencies actually improve the cell, how the cell is working.
That's what I'd like to possibly consider, because in my situation, what I have is quadrantenopia. So I wasn't even able to get that term from my ophthalmologist. I was home for 371 days following the stroke. So, you know, a lot of time to search and go to conventions and symposiums on brain injury. And I came up with
Figured
that
it out.
term, and that's exactly what I
Okay.
have. So
Okay, good, good. So I hope you learned something about brain glasses. It's always funny for me to say that, but brain glasses, neuroprisms or microprisms, and light therapy. And I'm done my formal presentation. If you have anything you want to ask me, or I'm here.